I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You have received the minutes of the previous meeting. What are your wishes?
Boom.
We have a motion. Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Jeff, let's chat first.
Not a whole heck of a lot's changed in the last couple of weeks. Still waiting on some quotes for pickups. Should be bringing that to you next week. Also, we're looking at the purchase of another pup trailer. The two spares that we have are really old. And we'd like to send at least one of them down the road. So that should also be on the next week's agenda.
What's the delivery time on something like that?
Still waiting to be determined. Hopefully before, so the one pup that we did purchase this spring was a couple months. I think it was three months. But we'll have that, should have that back in time for the new truck for it to go on. So,
Turbine project's going well.
yeah. They're kind of, I don't know if they got their second crane erected or not, but
I
I
think
know
they had
that,
3 up,
did they?
because there was one like South Wellsburg, there's 2 up in our area.
Okay.
Yeah.
I know they had the one up last week
Yeah.
during our meeting,
Mhm.
but I didn't know if they got another one up or not. All the components have been delivered. Now it's just, go time
Mhm.
to start building,
Do they,
start dismantling and then putting them back up.
so I mean, with the wind today, is there a limit on? If they'll
I
take
do
them
not
down?
know. I know they were supposed to, they had a wind delay on Thursday. However, they were building on Friday, but it's just as windy. So I don't understand. But there is a wind that apparently that they will not go in, but must have been something different up that area.
Say like 10 mph on them, less than 10 on the ground. It's a lot more up there.
Yeah. They've had a couple of them changed out. They're a little different profile, so,
A little different,
yeah.
so. I know their tower should be starting here shortly if they haven't already started construction on that ADLS tower.
Looked like just the groundwork was done when they drove by there. Or they were working for that. Imagine that too, doesn't take long once they get going.
Yep.
Kendall said he's got the speed limit signs moved on Pioneer Road.
Correct.
That's awesome.
And the city's passed their resolution, I believe. Or their portion of that.
Yeah.
So we do not need to, we don't need to act on it, I don't believe.
Right.
That's more of a city thing than a county.
Yeah.
Any other questions for Jeff this morning? Comments? Things? Josh,
We're gonna have to skip, and he's not logged in.
okay, no, that's. We'll just run down and do the bottom portion first and try to stay a little bit more on schedule with the scheduled items. We have a resolution number 15, 2025-2026, adopting a policy regarding subscription-based information technology arrangements. Ellen, do you wanna enlighten us on that a little bit?
It's something that the state auditors like us to, anything that's kind of a long-term technology agreement, they want us to amortize that over that time period, and we weren't doing that in the past. And currently, most of these contracts are not long-term anymore. Most of them are going to your subscription, so I don't know if we're gonna have a lot of them anyway. And then we were allowed to set the threshold, and she thought 25 was a better number. And I've seen counties range from 5,000 to 100,000, so it was kind of up to us.
Erica, do you have anything to add to that as far as? Would anyone care to introduce that resolution?
Move to introduce.
And we have a motion. Is there a second?
Second.
Alan, would you call the roll, please?
Yes, LJ,
Yes.
Mark,
Yes.
Heidi,
Yes.
Vic,
Yes.
and Jeff.
Yes.
The next item is to consider updated audit scope and objectives for the fiscal year 2025 audit and authorize chairperson to sign the same. And that change is
Price might go up a little bit because of a single audit.
federal audit, which is for the ARPA funds,
Yes.
which we are required.
Move approval.
We have a motion. Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? The county auditors report. Is that passed around?
Yeah.
And is it? I'm good with that.
No, I don't know if I saw
You know what? I always take it
No.
in and have Jesse print it.
Saw the others. I didn't see the auditors.
I did not put it in there.
I was gonna say.
I'll have to bring it next week.
Okay, we will, push
I
that.
meant to have Jesse sign it, but I got something else from him instead of this morning.
The sheriff's report was passed around. Speaking of which, we have a member of that department here right now. Is there a motion to approve and accept that report?
So moved.
Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Opposed. We also have the treasurer's report, investment report passed around. Take a motion to accept that.
Make that motion.
Okay, we have a motion. Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? And the county reporter's report was passed around.
Move acceptance.
Okay, is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Alan, any chance?
He is not there.
Not on yet? Okay. Well, we can go to the hospital. Board, we have a couple members representing the hospital here this morning.
Well, good morning. Thank you for time, on your guys' agenda. So just kind of to, our last meeting that we would have had earlier in 2025, really trying to, kind of have more, consistent communication and a kind of more frequent cadence than what we, I think, historically had with our annual meeting. So I want to thank, Jeff, for graciously, agreeing to participate and attend kind of our Board of Commissioners meeting. And then I envision that we'll probably, myself and Rick or future board chair, attend this meeting kind of on a quarterly basis, just to give you maybe more consistent updates instead of
Appreciate that.
trying to update you all on an annual basis. You will see us in January for our typical request of funds as well. So a lot of information, but I really wanted to kind of highlight just two probably of my agenda items the most. That would be our audit report, which just was presented by Ide Bailey, who's our auditor this last month. And then we're in the midst of our 3-year strategic plan. So just wrapped up our first year. So want to provide you all just some strategic initiative updates for that as well. So the first handful of slides you'll see are from the audit presentation at our last board meeting. The first 2 pages really address the Medicaid directed payment program, specifically what impact the One Big Beautiful Bill has had on healthcare, specifically rural hospitals. So if you recall back in earlier 2025, before the legislation was passed on July 4th, there was a lot of unknowns from our vantage point and seat of, okay, how big are these cuts going to be? We do have some clarity, but we'll be transparent that there still is a lot of unknowns with this legislation, which I'm sure everybody is feeling a little bit. But in relation to healthcare, there's really 3 key areas that I wanted to go over. So that will impact the financial component for healthcare. So that's provider taxes, state directed payments, and then this rural health transformation program. Provider taxes, and again, these are national programs. The state of Iowa actually is not above the 3.5, which is what the government this legislation is looking to bring that down to. So there's relatively little to no impact from a financial perspective in the state of Iowa related to provider taxes. Conversely, where we will see a pretty significant impact is in the state directed payment program for Medicaid patients. And this program, just as a reminder, was really designed to right size reimbursement for providers of healthcare, specifically hospitals, to receive payment for caring for Medicaid patients. So if you recall, probably the last 10, 12 years prior to the Medicaid directed payment program, there was not any pay or reimbursement increase from Medicaid. So it was not even in the same room in terms of kind of where that reimbursement level fell compared to commercial or Medicare beneficiaries. So what this program really did was elevate that to where we get paid from a reimbursement to our average commercial rate. And then the state also has quality measures for Medicaid patients that hospitals are obligated to satisfy. So the legislation that is in the One Big Beautiful Bill is proposing to reduce that from the average commercial rate down to 100% of the Medicare rate. So that delta, if you will, is really the decrease in reimbursement that all hospitals in the state of Iowa are set to experience starting in 2028. Iowa Hospital Association has put out specific figures for each hospital. They're getting some clarification on the details, which will matter, but worst case scenario, they're anticipating a $4.4 million decrease in reimbursement for GCMH over the life of the legislation. So that would be years 2028 through 2033. And then the last silver lining, I guess, of this legislation was the Rural Health Transformation Program, which proposed $50 billion, to go back into specifically rural healthcare. At this time, a lot of unknowns related to this program. The state of Iowa is working to submit their application for half of this program. Should back up. Half of this program is dedicated to each of the states and the states that receive a grant, and then the other half of the $50 billion is going to be allocated by CMS at their discretion based on a methodology they come up with. So I was focusing on the state grant program, and that application will go for CMS's review next month. So more to come, and I think many of you maybe are aware too, with the government shutdown, I think Medicaid and specifically this Rural Health Fund is, are being negotiated. So time will tell where that ultimately lands as well. The second page, so slide 4 here, where this actually gets into the actual dollar amounts with the Medicaid directed payment program. So the top figures, this is a statewide figure for the directed payment program. So in 24, you can see the state of Iowa received $1.3 billion, and then in 25 is actually scheduled to receive $1.5 billion. What's unique about this legislation too is we're actually, along with other Iowa hospitals, expected to see an increase in reimbursement until 28, and then we see it decline due to the cuts. So we are expecting continued increases through the directed payment program in the next 3 fiscal years. And then you can see at the bottom of that page, just the estimated impact for GCMH. So this program obviously is very material on an annual basis. In 25, we're expected to see $4.2 million. And then that figure is audited, and then they do a reconciliation process based on actual claims data. And you can see that we were actually fairly close, for the 24 settlement there. High level, noteworthy items that others left us with, and you'll see this theme throughout, kind of all the key indicators, financial indicators that they presented on. Hospital is going through a significant just growth phase. We're seeing our gross patient revenue, which means more patients, more services continue to increase. So this last fiscal year, that was in the tune of $6.6 million. The Medicaid directed payment program, as I mentioned, had a 4.2 million positive impact on our operations. We did close out our construction project. So officially the borrowing related to that with our USDA was finally closed. And then the USDA financing, some of this was luck and other was persistence from our board of commissioners wanting to continue through with our recent facility project. So that was the surgery, imaging, and then our lab department. We were able to lock in at an interest rate of 2.125%, which was the lowest that the USDA has been since the pandemic. And then for comparison, today's USDA interest rate is 4.8%. So very significant dollars that we are saving in interest related to that borrowing. At the bottom of the page, again, this is just a illustration of our growth as an organization as well. So you can see that there's been a steady increase in terms of our net position in terms of equity for the hospital, and that figures in millions of dollars. The next slide is more just to give you a sense of who the auditor is benchmarking us against. So the peer facilities at the bottom are like size critical access hospitals. And then you can see that who the auditors use for the critical access and then overall Iowa hospitals. So total margin, this graphic is a little backwards to read. So 2021 is actually in the middle. So this just looks at 5 years performance. But overall, you can see this last year we finished with a 19.3% total margin, which is very strong and above the Iowa average and majority of our peers. On to the next page, you can see our days in AR. So average days that it takes the hospital to collect payment. You can see that we are at 27 this last year, which again, in comparison to the Iowa hospital average at 43 days is just a real testament to our revenue cycle team and the efforts that they have. And typically what you see with really financially struggling hospitals, the first thing to go is their revenue cycle, and they struggle to adequately collect appropriate payments, and then probably more importantly, timely payments. And that was a big kind of lesson learned for the Marshalltown Hospital when they had their issues several years ago. Days cash on hand. You can see the Iowa hospital average is at 187. So this last year, GCMH was at 350 days cash on hand. This continues to probably be stronger than we even forecasted prior to the building project. And a lot of that is due to the directed payment program. And you've seen that really, what I'd say just influx of payments to all Iowa hospitals has really elevated everybody's cash reserves. So in a very healthy position from days cash on hand right now. The next slide looks at our long-term debt to capitalization. So this figure lower is actually better in terms of how our organization is leveraged from a borrowing perspective. So you can see we were at 36% this last year. Big reason for that is obviously our new USDA borrowing, but you can see that it actually came down from 24, which is in part because we paid off our parity borrowing for the building project. So that was through local banks, but obviously higher interest rates, and the board, as we were generating cash, chose to pay that off instead of continue to pay the interest on that borrowing. The bottom of the page looks at our average age of plants. So we routinely get comments about how beautiful our hospital is. And just this last week, my wife ran into a coworker at a different hospital. And she commented how convenient it is to travel and just come to our hospital because there's no wait, and then what a beautiful facility and our staff from a patient experience. So I think just speaks testament that you have people who are working in other hospitals that maybe are traveling out of their own market to come to GCMH to experience the services that we provide. And then one thing that we do bring to you all each year after our audit is, and I did put the detailed list that our auditors put together, which is shows all 41 county hospitals in the state, their levy rates, and then what that equates from a dollar perspective. But you can see really what I want to highlight here is just the average of county tax or subsidy that those county hospitals are receiving. You can see on average in 2017 that was a little over $1 million, and now that's increased up to $2 million. So certainly some sizable increases in terms of county support towards rural hospitals. You all, I believe, are familiar with our economic impact and community benefit report. So the summary is on the bottom of page 7 there. From an economic impact perspective, that's really based off our audited financials. That populates that, so you can see in fiscal year 2024, we provided 376 total jobs. From a wages perspective, that was 22.7 million, and then total expenditures or GDP was $44.7 million. And you saw a lot of, obviously, the growth with that kind of equity page, and I would say if we were to show our FTEs on this similar year trend, I was telling somebody just recently, I think it was 2018, we probably had 130 FTEs and we're up to 200 FTEs as an organization. So as we continue to add services, as we continue to care for more patients in our market, we're also growing our workforce, which is a really neat benefit to celebrate. Community benefits. So this looks at several things. This is information that Lisa Zinkula, our CFO, puts together. You can see that roughly $800,000 is just attributed to financial assistance or bad debt. And then on the next slide, you can see that we do have several services from a hospital perspective, even after we allocate overhead, that are operating at a loss. So our ED being one of the larger ones, but all of those services in the tune of almost $2 million. And then one thing that we're placing a lot of focus on recently, just with, as I mentioned, our workforce growth, is how do we engage kind of the youth and whether it's high school students, and then obviously we're focused on college students as well. But we've started a lot of programs to get them exposure, just to learn about careers in healthcare, and if that's something that piques their interest. And we've had a lot of good participation from students participating in that. And then we obviously provide a lot of education throughout the various clubs within Grundy County, and some of those are listed there. So all of that to be said, roughly $2.9 million in community benefits were noted, and that impacts around 11,113 kind of encounters. Okay, so moving on to some strategic plan updates. The top slide is just a infographic of our strategic plan, which we call Onward. You can see the 5 pillars of our strategic plan are be the trusted health partner, accelerate innovation, advance talent and culture, foster organizational unity, and then focus on fundamentals. So moving to the bottom, the pie graph just shows you how we kind of concluded all of our initiatives after the fiscal year 25. You could see that we never complete as many as we want to, but there was a lot of progress on almost 19 other ones that we had, and then we also kept 13 additional where we might have changed the fiscal year, and that was either moving it from 2025 to 26 or even 27 to 26. So each year the board goes through a kind of a review process where they assess, okay, are these initiatives still applicable and relevant based on what we know now? You know, big topic this last review session was the one big beautiful bill, which wasn't even on our radar when we, you know, came up with this plan a year earlier. So yeah, I think it's been a good process that we have in cadence to our strategic planning. Some noteworthy items. So the bold items are items in 25 that are actually completed. So we really revamped our organizational structure in our emergency department. And I keep telling people our ED is probably one of the best kept secrets around. So very rare that an emergency department is staffed solely by physicians. You talk to my peers in other rural hospitals, that is a very rare thing. And then you look at the level of experience that our ED physicians have. So we really wanted to invest in our medical director and the selection of that. So Dr. Todd Lawrence moved into our medical director position. And he's really tasked, along with Cam Pinning, who's the nurse manager, to drive kind of quality improvement efforts within our ED. But really outstanding performance that we have today, but obviously always room to improve, which those two are focusing on. The next is how do we engage our medical staff? So Dr. Neverman, as our chief medical officer, really led the effort of having an annual medical staff education offering. So that was held at Barley Roots this last year, and that's something that I know we're planning to continue each year. AI obviously is entering its way into every industry, so healthcare is no exception. So it was important for us, as a lot of other hospitals, to really define what is the governance around our employees, but then also how we select AI tools and implement them in terms of how we actually care for our patients. Probably the most significant movement that we've seen with AI is ambient listening tools. So in a primary care clinic specifically, now there are tools that will actually record the conversation between you and your provider, and then it will filter out all the social conversation, and then it'll prepare a clinical documentation or note. And then the physician or provider still is required to review and sign off on that note, but it's reducing significant amount of documentation time where the provider is really focused and typing while they're talking to you, which we've all experienced. And now the hope is that they will be able to engage with their patients more directly and not focus on the documentation piece. So ambient listening is something that has made its way into healthcare, and I think you will see that continue. It's in primary care predominantly now, but I think you'll see that where there's documentation throughout the hospital, you'll see that transition occur probably in future years. We did resume our patient family advisory council, so that was suspended during COVID. So happy to have some community members back on that committee, just giving us feedback, hopefully constructive in terms of where we can improve. And then we also did enter a partnership with Grundy Center Police Department, where they check external doors overnight and have a presence for our third shift. So that's also been well received, by our associates in terms of, security and safety. Some things that we, again, are in progress, but, some of these we've actually implemented, already in fiscal year 26. We went live with a patient communication tool called Artera. So if you, similar to your probably haircut or dental office or primary care, if you have an appointment, with the hospital, now you'll get a text reminder. So it's really the start of how we, communicate with our patients. We also have been really since March, April timeframe, working on our master facility plan, and updating that. So as you can imagine, after coming off of our, large construction project, which concluded in 24, every 5 years or so is, kind of best practice where you update your master facility plan. So we engage CMBA architecture, firm, to assist us with that. They will actually be presenting, to our board later this month, and then they're expected to give rough pricing, that will help kind of advise the board of, maybe what do we want to rework or what do we want to proceed with, moving forward. So probably not any, firm decisions. I don't want to speak for Rick, related to master facility plan, probably till closer to the end of the year. So I think there'll be a few months where the board will want to deliberate and have some discussion and, have some follow-up questions or work that they want us to bring back to them. But really the focus of, this plan, so we vacated our, old surgery to build a new surgery. So that's a 1968 facility. So really it's kind of finalizing what we've already started in terms of all the spaces we maybe vacated, to build our last project. What is the long-term vision for those spaces? And then there's some other departments, obviously, that we've outgrown space that we need to, accommodate as well. Something as, a parent of 2 little kiddos that I'm really excited about is our local Grundy Center Family Med Clinic will be expanding, their hours. So starting, I believe, November 5th, they have hired a new, nurse practitioner that will be, holding clinic from 12 to 8, Wednesday through Friday, and then Saturday 8 to 4. Really to just accommodate acute or urgent care, like visits. So we have a lot of patients who are, either using our ED, for those kind of urgent care like visits, or they're traveling to Marshalltown or Waterloo. So this will be a good alternative, where people can receive, that service offering here locally. This will be phase 1. Our kind of long-term vision is for this to be 7 days a week, but we're gonna kind of test the concept, with 4 days a week to start. We also started respiratory therapy, in 2023, and that was, really at a necessity from the pandemic, where we identified a gap of not having that service, on site. So we engaged a third-party contractor called Beam, where they will actually provide telerespiratory therapy services, after hours and weekends to complement, our staff that are on site Monday through Friday. So will be a really good, resource, and continuation of care for our, nursing staff for kind of our medical patients that, are using some respiratory device, to support their care. We also, hired and purchased a new vascular ultrasound, machine. So this is diagnostic, machine that also helps, with echocardiograms. So really ramping up our, kind of cardiology diagnostics, now 5 days a week. And this kind of opens the door for us to, have other kind of telecardiology services in the future where they can rely on that test. And if that patient is safe to stay in Grundy, or if they need to be transferred to a higher level care, facility. So really excited about, providing that, need locally on a more expanded basis. And then we will have a new website launching, next month. So that has been very time consuming, I know, for our marketing and communications department, but really in an effort to try to simplify kind of the experience for people that are using our website. You'll see that change come the first week of November. And then we also have had a lot of work from a board development plan. So want to just recognize Rick's leadership. He's been very focused on how do we further expand kind of the education of those that are serving on the Board of Commissioners. So the Iowa Hospital Association has what they call a trustee certification process. Since I started in 2018, we have not had any trustees that are certified until Rick became the first last year, and then I think we'll have about 3 or 4 others that will be recognized this year for their education related to those requirements. And then you might have seen in the paper, Deb Cooley was our most recent addition, and I know maybe that came to a meeting here as well to approve. So she's really hit the ground running. We just wrapped up her board orientation a couple weeks ago. So lots of things going on, but mostly positive things that we can report. The next page just touches on a few new initiatives that we added, and some of these are really just a consolidation of our review process. So won't go through those in any significant detail. And then the last 3 slides want to just put on your radar. That way, if you see hospital team members in the community, you can congratulate them and tell them good job. But we did receive 2 workplace awards, one from the Cedar Falls Courier, and then the other is the Des Moines Register top workplace, both of which we have won and received for numerous years now. And then for the 3rd consecutive year, we were also recognized by NRC Health, which is our patient satisfaction vendor, as the top critical access hospital in the nation that they work with from a surveying perspective. So
Stop you there
Yeah.
because they probably, I would like to know that you received the Outstanding Young Executive Award from IHA as well this year. We were just down there and Adam received that award last season. So
yes, it was a surprise. But I tell people healthcare is not a individual sport. So it's really good reflection on all the amazing leaders and board and people we have, and just community support. So to have good healthcare, it takes a village. And I hope you all know that you play a big part in that too.
congratulations.
Thank you. Any questions on anything I went over, anything I didn't go over that maybe you're hearing about?
You know, our family is very appreciative of having a hospital and all of its services. I'd say very local. It's
Was this urgent care, is that in operation right now?
November 5th.
November
Yep,
5th.
so it'll be operated out of the current Grundy Center Family Med Clinic. Again, Wednesday through Friday, 12 to 8 p.m. And then Saturday, 8 a.m. to 4 p.m. And they're really starting this, they're not calling it urgent care just because that gets complicated with us having an ER on site as well. But yes, acute kind of urgent care like symptoms there, that's really what it's designed for. And you can schedule either through my chart or by calling the clinic. So they will be taking schedule appointments only to start, and then I think we'll see that evolve as we kind of fine tune our operations there.
No, so spread the word on that.
Yeah, there, you will see a lot more marketing. I think we're doing direct mailer, and then you'll see a lot on social that starts to come, but yeah, appreciate you helping spread the word for that as well. And then Shannon Apple will be the primary provider. So she's a local Grundy Center provider as well.
questions. We appreciate the update and
Yeah.
just know what's going on out there and
Our pleasure.
problems, the good things.
Well, if something comes up, you know how to reach us, but thank you guys for time on your agenda.
Yeah, thank you for your support. I mean, I know every year you have to make the decision to support us, and it means a lot to the board and the hospital employees, who's the county supports the hospitals. Thank you for that support.
Awesome. Appreciate you keeping us informed and yeah, what's going on, because it is a major part of the county, so thank you.
So we'll be probably back in January.
Great. Talk to them.
Thank you, guys.
Thanks, everyone.
We bet.
Alan, is Josh
Yes.
on?
Well, unusual.
All right.
Are we ready?
Yes.
Okay. Hey, I apologize. I had 9:30 on my calendar and I see it's 9:15, Alan. So I do apologize for being late, but here I am. So I can make it brief and just talk a little bit about the food bank and kind of what we do and how it relates to Grundy County.
That'd be perfect. Thank you.
Okay. Thank you so much for having me. Yes, food insecurity. The numbers are higher than ever since I've been with the food bank. It has just continued to grow and grow. My role, like I said, my name is Joshua Stevens. I'm the donor relations manager. So I deal directly with trying to bring money into the food bank and just trying to keep us sustainable by finding grants and also finding just ways to raise support, especially for our 16 counties, which Grundy County is one of them. So right now, some of the numbers for fiscal year 25, the food bank had provided 8.6 million meals. We do that with the help of our volunteers. We had just about 11,000 volunteers that helped us this last year. That equaled up to about 35,500 hours. So we couldn't do it without our volunteers. We have 127 agency partners. A lot of them right now are spread throughout our 16 counties. Some of them are in Grundy County as well. Some of the food banks and also our mobile food pantries, and then also churches that we work with. So right now, and I'll touch a little bit more about specific numbers with Grundy County, but I'll just tell you kind of overall in our service area, there are about 45,000 Northeast Iowans facing hunger. So that's 1 in 6 children. So the numbers are really staggering. There have been a lot of cutbacks, so we've had to find ways to make up for the loss and try to really fill in the gaps. So let me dive in a little bit about what's going on right now in Grundy County, and then I can do the best I can to answer any questions at the end here, but let me just take a look here real quick. Okay, so right now, I want to focus a little bit about the total meals that we distribute through, like I said, either our partner agencies or it could be the mobile food pantries. Mobile food pantries it's the semi truck that pulls up once a month. We find a location either at a church or sometimes it's a parking lot, and then it's tailgate style, and people just kind of find out about us through social media. We invite people, and then we just empty a complete semi truck right there, like right on the spot. So right now in 2025, it looks like our total meals distributed in Grundy is 134,491. A lot of meals, very busy. We can convert that to pounds, but the best way for me to basically say what we've done is just to say by meals. I think that's the easiest way. I can focus a little bit about has anybody heard of our backpack program that's for the children? Just curious.
Yes.
Yep. We do several packs throughout the year. And it's a really big deal right now. We also are in school markets, which is another way of saying school pantries. But the backpack program is very important right now because it's what the teachers or different people that are in charge, they slip a bag of food that will get the child through the weekend. Parents are aware of it. We try to keep it as discreet as possible, but it's becoming more and more important. Since I've been there, it's a very big deal. We'd like to transition a little bit more towards the school pantries, but right now this backpack, the logistics aren't as smooth as the school pantries could be or our school markets, but right now it's like a really big deal to me, raising support for it. So right now, in 2025, fiscal year 25, we distributed about 4,000 bags to these children. Lot of 4,000 meals, 4,000 meals to the children. And they just really go a long ways. They might have like a pudding cup, it might have granola, it might have a box of macaroni and cheese. We try to keep it simple. Juice boxes, try to keep it simple. So the child is able to prepare it themselves, or they don't need to use a stove. So it could be like a microwavable dish or something like that. So a lot of different ways. We also have elderly nutrition. I mentioned our mobile food pantries, school markets, and then obviously a lot of our partner agencies are very important to us. I know I'm talking fast. Maybe I feel, does anybody have any questions about what we do or how it relates to Grundy County?
I don't think we've got any questions right now.
Okay. Well, I will say this, by necessity, we have started we call it a capacity campaign. And basically what we've found is that we can't store enough fresh food at our location in our cold storage or in our pantry for the area. So our truck drivers will take the pallets and bring them out to different counties like Grundy County, and we just don't have the space. So we've started a $14 million project. So far, we're up to $7 million raised. So we're doing very well. It's by necessity. It's not that it's actually, it seems like it'd be a good thing we're growing, but it's actually evidence of a bad thing, because that means that we need more space. So it's just something we've taken on, and I've been just wanted to bring it in front of the different counties that we do serve. So that's one of the other reasons why. And I can send some information about that to Alan if you'd like me to, about our expansion, and I can bring it in front. But basically, we've broken ground. We've moved along really well. Very exciting. A lot of people have taken notice. It's been on the news a lot here in Black Hawk County, but news will begin to spread to all of our counties that we serve as well. But once again, by necessity, you don't want to grow, but we have to grow because of what's the food need that's happening right now in our area. So I can send some more information your way, Alan, if that works.
That'd be great.
Yeah, that'd be good.
All right. Well, I do appreciate your time. Like I said, I just wanted to speak with the board here and just kind of let them know what's going on. And we're in your community every day and monthly for our mobile food pantries. But we work with all the different agencies and different schools, and just wanted to keep that in front of you all. So thank you so much.
Thank you.
Thank you.
Thank you.
All right. Thank you for your time. I really do appreciate it. Thank you.
We appreciate what you do. Thank you.
Thank you. Yeah. Have a good day.
Yep, you too. Okay, I think, did I get everything? Okay. Is that?
Yep.
Your auditor's report? Did you
Yes.
Bring that in. Okay, we can pass that around.
Very long one. Not much in the first quarter.
Whoops, sorry. Yes, we have the auditor's report. Anyone will move to accept that?
So moved.
We have that motion. Is there a second?
Big Bev.
We have a second. All those in favor signify by saying aye.
All right.
Any opposed? Passes. And I think the last item on the agenda is updates on board and committee meetings. Did anyone have any meetings this week?
Landfill was canceled.
Okay.
Whoever's in the field.
Everybody was busy.
We spent half the day deciding whether we're gonna have it.
Vic, do you have?
Didn't have anything.
No?
I didn't either. Nope.
I attended the Iowa Public Information Board training last Monday, 12 to 2. Thank you. It was interesting. There were some points that were clarified. I know that they did bring up the issue of the availability of the course, and for those that are being appointed, they are trying to, at least to kick it off, to get more sessions scheduled to be able to get everybody caught up. Once that is done, they feel that they will be able to keep it up as new appointees and new elected officials, will need that training.
So you actually got in?
Yeah. Mhm.
I tried.
I'm a pretty fast clicker.
Must be faster than.
So, yeah, it is hard to get.
So if we have to adhere to all these new rules and regulations, are we gonna have will there be a designated person in our county who sees to it that newly elected people and others actually have access and are made aware that they need to attend this learning session?
Well, to the best of my knowledge, being somebody who was not able to get into a session, Heidi, correct me if you have different information. I don't think the law has any provision for the appointment of an overseer of, county official attendance. To be proactive about it, I suppose, it would be the duty of the chief law enforcement officer of the county to and make sure that people know that the training is available and how to sign up and all of that kind of thing. As far as that officer's ability to ensure availability of the programming, that is literally out of my hands because that is at the state level. The state has mandated to the Iowa or to the IPIB that they have to develop, implement, and provide a no more than 1.5 hour course, but there's nothing in the law that says how often. But I think they're seeing that people are trying to get ahead of it, which we all appreciate because as has been pointed out multiple times, this is applicable to newly appointed, newly elected, which arguably none of you are, because that election cycle hasn't hit yet. So it will be increasingly important after November 4th. But having gotten it taken care of ahead of time, I think they're using this time period maybe to see where my hope is that they would be using this time period to see the issues, to understand that people are trying to get in, not able to get in, and that kind of thing. But there is basically, right, a 90-day window after the election to get it taken care of, and I would anticipate that those courses, there will be more courses available in those 90 days simply because of when the law becomes effective. My hope is that they would also have this available on demand and not just live, which is beyond irritating in this day and age, but I don't know if that answers any other questions.
I don't think the on-demand, as far as IPEB is, that was a question asked. There was a lot of questions and they were very good about answering them as they were, like, the chat was, very active. And some good questions were asked. One of them being, would it be something that you could access like a webinar type thing? And it seemed that it will not be something that would happen soon, only due to the fact that things are constantly changing. It doesn't allow for the interaction with questions. And it was also brought up, of course, that, there are gonna be fee-based services available. That too is why they are increasing the number of sessions they will be offering, because you kind of want to get it from the right people. And they want to make sure the same information is being distributed. That was one of the things that was brought up. So I think it's hard to believe, but something was implemented with maybe some of the consequences not being seen. And now that they're being seen, they're being dealt with just probably not as quick as,
We're beta testing this, is what I'm getting.
kind of like, so.
Well, this system has to be as simple as possible and as convenient as possible, or we're not gonna get people to volunteer to be trustees in this county.
That's the thing.
Amen.
I mean,
And
and,
they're not gonna pay a fee to watch this.
and you know,
That's a ridiculous requirement.
trustees are even, they're, and I'm not gonna say they're getting paid, they get a fee for being a trustee. There's other boards that are appointed that they are not compensated at all.
Exactly.
Mhm.
And, you know, and then when you add in cities and there's a lot of people serving.
You mean, I think what I'm hearing here is that a law was passed without being fully thought out. I'm-
Has that ever happened?
Without
before?
input being asked for, perhaps.
I'm so glad I'm sitting down for this.
I can see that look of shock on your face. And,
That's what this is.
yeah, I think there's, you can communicate that to the appropriate people. If you would like to use that time in that manner. Don't know.
You can still write,
Question on,
you could write those people that pass the laws into those places, into those positions, right?
Mhm, mhm. So, you know,
my daughter's up for election to the Rhinebeck Library Board. Elected
right.
position,
mhm.
she would be required to take.
Yeah.
Take this course?
Well, I would defer to the city of Rhinebeck's city attorney, but the question is the library board a governmental agency subject to open meetings laws? If yes, then your answer is yes. Yes.
Mhm.
Mhm.
So, yeah.
Our appointed park board members and all of them, they all have to take it.
If you look down our list of boards and commissions. It's a lot of people.
It
I mean,
is.
on the plus, side, I guess to, on the plus side, maybe, or to argue the opposite. A lot of the commissions you guys are on have a lot of the same faces. So, at least in theory, most of your people would have already taken it because of some other board or commission that they're on, but certainly that's not everybody.
So is it a one-time deal or is there continuing ed with it or all that or?
I did not see anything about continuing education pieces. It was just within 90 days, take this course. So that you have some idea as to what the purpose of open meetings is.
And if I recall, and I will say that I did not take notes, I believe that one thing is if you are registered, if there would be something, an update or something changes, they have your information stored from taking the course that it could be communicated
Oh, good.
perhaps to you.
Perhaps.
But I'm not, don't write that down.
Well, to keep track, is IPEB gonna give out a certificate or something that people can? share?
Yes, you will get a certificate. It will be emailed.
I'm thinking that I probably should just update our list of boards and commissioners
Yes.
into a spreadsheet and have a column for if they've completed that or not and track that.
And then you
And
should receive a
See
copy.
if some other counties have already developed some sort of a letter of notification, because seems like good timing to have something ready for newly elected people to include with their, notice that they did win, so I think
Right.
get kind of in front of it, and there's probably already a piece out there, so
And they.
I'll kind of
I'm sorry,
collaborate
they have
with some other
something.
ones, so.
I said that.
So are you
Are
re-elected or are you newly elected?
It would be, I think right now that it's a newly elected,
newly elected?
but it's
You
possible.
run
let's
for
say-
election every 4 years, so you're newly elected for that period, so you.
It's possible.
You're newly elected in November. You're not newly elected in October.
So it looks to me
It's
like
my
the way
interpretation.
I look at it, you're gonna have to take it every time you're elected.
Don't look into that.
Well, they've got 4 years to figure out what they mean by newly elected.
Yeah. Mhm.
You are absolutely correct, Vic, having a definitional section as to what that means, because reasonable people can differ. Mhm.
So yeah, like, yeah, it raised a lot of questions, and I think that was part of it, you know, because there is a lot of, well, a lot is defined, there is still a lot of gray area also.
Mhm.
Anyway, also had the switch turbine update meeting on Tuesday. That was very nice to have, just to know how that project is going, and, Chase had a really good report. They did a mock drill, and that was pleased that they were able to do that. Friday, had Iowa Northland Regional Housing Authority. We were going over our personnel policy that the new housing rates came out. Let's look at those, as soon as I find them. Their audit, we had to update, it's on time this year. They will be sending out an RFP to see if they can interest anyone else in doing that. Right now, the housing vouchers are down, and there again, a lot of this is with the government shutdown. That have their funding, but there's things up in the air for that also. And I met with the behavioral health ASO, Katie and Jordan also. They're considering using the office space in the annex a couple days a week, or to start with a day or so a week. But we are in talks with them on that. And right now we have a couple other agencies interested in having behavioral health personnel in those offices. So we are trying to get as much of a presence in the county, personal presence as we can. That's what I have this week. But you got anything for us today?
It's probably been 2 weeks ago, I think it was, when the Blackhawk sprinkler guy was there to do his quarterly update, and he had mentioned that PIV valve outside that I brought to you guys when we were doing that building about, it doesn't work, that shuts all the water off to the sheriff's office as far as domestic and to the sprinkler system. When we did that plumber who was there, they'd given us a bid of $16,000 to $19,000 to replace that.
Yeah.
Friday, if it was, the Blackhawk sprinkler guy came back with a tool that he has, mechanical tool, and spent an hour and a half probably, hour, maybe?
Seemed pretty quick. I expected longer.
Yeah, he got it working.
Oh,
Which in turn will say, that thing's supposed to be exercised every time he's there to do it. Well, he's a newer inspector for Blackhawk County, or for Blackhawk sprinklers. And he asked the first time he was there, if anyone's ever exercised that, and I'm like, not that I know of. And we went out there, we couldn't move it. That was when Gary was here, because Gary was gonna come in and try to get it open with a pipe wrench and a loader. They push on the pipe wrench to try to get it. Well, they made a tool out of a threader, a pipe threader, and this is the hardest one he's ever had, he said. So he got it going up and down, and now you can spin it with 2 fingers. So they just pretty much saved us 20 grand.
Nice.
So I don't know what it's gonna cost us for him to do that. He just grabbed it, said he could come over and do it, and you might as well give it a try. Said I hate to see it on a Friday, but if something happens, then we're documented, but he got it, and I'm very grateful to him for doing that.
Nothing floated.
No. And like I said, now you can spin it. He's gonna exercise it every single time he's here, so that he's supposed to. And we also got a call last week, and I talked to Heidi about this. The asphalt company's coming tomorrow to start milling out the gravel and everything, and then Wednesday they're coming to during the meantime, Kirk and I have been talking, and there's gonna be a lot of rock in there that needs to go somewhere. Well, either they're gonna take it, or we could find some place to put it. Well, I had talked to Nick at Conservation, And he was gonna have to get rock for the Holland Marsh, for some of the roadside parks and stuff, and I'm like, you might as well use it, I'm like, otherwise they're gonna use it and they're probably gonna resell it or whatever. So I know he was gonna talk to Marty and see if you guys had available a couple dump trucks to haul,
Tomorrow.
yeah.
I have not heard that from Marty yet, but
Okay, otherwise Nick said he has a dump trailer that can haul 2 to 3 tons, which I think there's gonna be quite a bit of rock to haul. Out of there with them milling out almost 3.5 inches of rock through the whole thing.
I'm sure we'll have something.
Okay, it would help out, I mean, it would help him out a lot, just as far as, and them moving it or whatever, because otherwise, I mean, it's gonna be a. Cause I called Chad too, just in case to get a price, but he hadn't gotten back to me yet, as far as hauling it, but it would really help out a lot to get me. Those, I mean, it's free rock to those guys, so they might as well, I told Heidi, I said, someone might as well use it, I'm like, we've paid for it to be up there, I mean. To be put down, so someone might as well use it, there's, it's gonna be that much, and Nick was. He said he was gonna have to get some this year anyway, so,
Fuck that one.
yeah. Yeah,
Good.
and he, like I said, he's very grateful for it, so. That's about all I have.
Zach, do you have anything for us this morning? How are things, are you busy over there or?
We've always got something.
Anything on the quiet weekend?
It didn't look too bad. Not too bad, I read calls this morning. Fair if you want it to be.
No high-speed chases anyway.
No. Last 7 days or.
Yeah.
No red cars.
They end up in another county with honey weather.
Coming off a full moon, so you never know. Erica, do you have anything for us this morning?
I do not, but I was reminded of 2 things I need to get done, so thank you.
All right, is there anything else to come before the board this morning? If not, I would take a motion for adjournment.
So moved.
We have a motion, is there a second?
Okay.
All right, all those in favor, signify by saying aye.
Aye.
You opposed? I didn't think so. Thank you.